Hi everyone, this is my Teach 1 assignment for the topic of improvement by design. The assignment is to design how genetic information can be used in the management of depressed patients. Let's first discuss the overall situation this problem wants us to tackle and design a solution for. We are told that a patient calls in to a doctor's office complaining about severe depression. Given the case of depression and the possible suicidal thoughts that may be accompanied with depression, the doctor or receptionist must make sure that the patient is safe and calm. Obviously, the goal of the doctor is to help and treat the patient as soon as possible. However, before that, the doctor must determine what steps are needed in order to successfully and effectively treat the patient. The major steps of the plan is to design a EMR that will be able to manage the patient's depression and provide the doctor with essentially a folder that will allow the doctor to input and store information of the patient throughout the treatment process. Next is to gather and input information of the patient's medical history. Based on the medical history, the doctor will design a medical plan to collect genetic information about the patient and determine how that information will be used to create a treatment plan. Finally, based on all the medical data collected, the doctor will be able to create a detailed and well-studied treatment plan for the patient. The first step is to have a set of assumptions. We can assume that the patient has first been seen by his or her primary care physician at a private practice that follows an HMO model. We can also assume that the patient has been referred to a private practice by a psychiatrist. And we can also assume that the patient has insurance, an assigned pharmacy based on the insurance, knowledge of his or her own medical history. And lastly, we know that the patient is suffering from a non-prescribed depression. When the patient calls the primary care physician to inform the doctor of his concern with having depression, the receptionist will ask for some basic personal information. The information needed for the first call involves sharing the patient's name, date of birth, the reason for the patient's visit, determine if he or she is insured or not, and if the patient is insured, the receptionist will collect the policy number. If there are any previous records that need to be transferred from another clinic, the receptionist will ask the patient to have those sent via email or mail before he comes for the appointment. The request for email or mail is mirroring a major problem in the health system, which we will discuss later on. Finally, after the general information about the patient and the reason for the visit is collected, the receptionist and patient will decide on a date to schedule the first appointment. During the first visit to the physician, the receptionist will ask for general information needed to make the patient record for their clinic system. There will be a few pages provided by the receptionist asking the patient to fill out regarding personal information, including social security number, date of birth, address, sex, etc. Medical history will also be taken, which includes previous shots and vaccines, or any signs of heart systems or major injuries, and a description of current symptoms that the patient is feeling from the depression. Then, once the patient is called into the doctor's office, the physician will conduct an initial physician evaluation in which the doctor will check temperature, blood pressure, observation of physical behavior, and more, just to get an understanding of the patient's body and his or her general health. Once the evaluation is done, a diagnosis will be given based on the doctor's measure and determine if the patient has depression. The doctor may also prescribe him an antidepressant medication with a follow-up appointment within a week. If the physician believes a patient does in fact have signs of depression and the antidepressant did not work, a genetic consultation appointment will be scheduled. Between the first and second visit, the genetic consultation is scheduled. The patient will most likely be referred to a psychiatrist or geneticist by the physician. Once the patient arrives, the patient will most likely need to fill out personal information, social and medical history, insurance and symptoms for the geneticist's office, unless the primary care physician is able to transfer the patient's EMR to the facility. The psychiatrist will order a DNA kit for the next visit, And finally, the patient will schedule a follow-up appointment with the psychiatrist. Since it takes a minimum of 4 weeks for genetic results to come back, there will be appointments scheduled in the time between the follow-up. The patient will have a second appointment with the psychiatrist where a sample of saliva will be taken for the DNA kit, and it will be sent back to the ARUP, which stands for Associated Regional and University Pathologists Incorporation Laboratories, for lab tests. 8 weeks after the first visit to the primary physician, a second appointment with the physician is held. The patient will confirm their personal information and any new symptoms or progress. Further evaluation will take place in the room. The physician will update the EMR with the genetic results and review the genetic test results and its meeting with the patient. Based on the physician evaluation, the doctor will discuss the different treatment options that will suit the patient and will be most effective. Once the treatment plans have been discussed, a single treatment plan will be established. The doctor will prescribe the required genetic specific medication and discuss a follow-up plan 8 weeks from the visit. Documenting the use case, we can determine that this patient was a depression medication management case. The purpose of this case is to show how a physician may use genetic information to treat depression, rather than prescribing antidepressants automatically. The primary actor, meaning the main doctor involved, is the psychiatrist, and the secondary actor is the ARUP lab. The starting point is when the primary actor ordered a genetic test and collects saliva samples of the patient. The saliva sample is sent to the secondary actor who performs a genetic test, and the report is sent back to the primary actor. The endpoint is when the primary actor receives the report and decides the treatment, and the patient's genetic information is updated with his report for future care. The information exchanges began with the psychiatrist providing the patient's name, demographics, diagnosis, symptoms, history, and saliva sample to the genetic laboratory. The genetic laboratory provides the genetic test report with the patient's genetic information and the identified issues to the psychiatrist. The measurable results are represented by this genetic information that is updated to the EMR, and the physician is notified for further analysis. This is a diagram showing the flow of where different types of patient information was collected, when it was collected, and with whom it was shared with. There is a lot of information about patients that are gathered from different clinics. There needs to be continuity in how information is gathered and shared so that information can be transferred easily, accurately, and cleanly to different offices. This process shows when and what information is needed for the EHR system, how the information is accessed among multiple actors, and how genetic information manages treatment. One of the main recommendations is to stop asking the patient to provide information over the phone and then again fill out papers once at the doctor's office. A solution, since we are in a society that relies heavily on technology, is for the office to require that patients fill out their information online on their patient portal prior to coming to the office. There also needs to be a system where all medical offices, no matter what type of clinic it is able to share patient medical records so that patients don't need to provide the information again and again. Even if the clinic does not share the same EMR system than the office they are receiving the information from, there should be an option for the record to be sent in a default format. This would greatly reduce the number of visits because, for clinics that do a pre-appointment meeting to gather information would not be required anymore, and information would be shared to all medical professionals involved. The result would be that the updated medical information on EMRs from one doctor would be automatically sent to other doctors. Thank you for watching. I hope this presentation was helpful in understanding this assignment, but most importantly understanding the process of how patient visits in general function in our current healthcare system. Based on my understanding and process of this assignment, it is evident that the sharing of information among different medical facilities is flawed, and there is no reason that a universal healthcare universal EHR sharing system cannot be established.